Good evening and welcome to the National Institute of Integrative Medicine. My name is Salih Miftari and I'll be moderating our interactive discussion this evening. Well, many of our viewers here in Melbourne tonight are once again in lockdown, and others across the country are watching this evening as cases worryingly rise in their states. Our event tonight is oversubscribed, evidence of the concern across the community about COVID-19 and its effect on our daily lives. Indeed, as we start to turn our attention to emerging out of hibernation, many are also thinking about locking down the habits, bad habits, formed over isolation. Tonight, Dr. Tamara Nation and Dr. Chris Corcos will discuss these issues and take your questions live. They're not wearing masks tonight as they're joining us from their homes, but we do wish to remind everyone that from tomorrow here in Victoria, please do wear your masks. Dr. Tamara Nation is an integrative general practitioner with a special interest in paediatrics. She is a fellow of the Royal Australian College of General Practitioners and genuinely believes that good health lays a solid foundation to a good life. Dr. Chris Corcos, known to some who have watched previous webinars at NIIM, is a clinical psychiatrist of over 20 years standing. Having undertaken his initial studies in the United Kingdom, he is a fellow of the Royal Australian and New Zealand College, of Psychiatrists, and he has a particular interest in nutrition and holistic medicine. This webinar tonight and the other important public health promotion work we do at NIIM has only been made possible by our very, very generous supporters. If you are in a position to make a donation to NIIM so we can continue this work, you're able to do so by going onto our website at niim.com.au, that's NIIM.com.au. Tamara will commence with her presentation and then we'll go on to Chris Corcos before answering your questions. Dr. Nation.
Thanks, Salih, and welcome everyone. It's an absolute delight to be here under these difficult circumstances. So well done and for coming along tonight, and thank you so much for joining us. It's great to be with you. So in terms of the topic, it's all about emerging healthier during this period of COVID and lockdown. And for us here in Melbourne, as well as across Australia, we have certainly been in lockdown for a significant period of time. In fact, at this point in time, it's 18 weeks that we've been through this dramatic change in our society. So it's no wonder that there are many indirect complications of lockdown itself, separate to the actual COVID virus. And tonight I'd like to take the time to discuss this with you from a general practice and integrative medical point of view. And the first area I would like to draw attention to is our mental health. We all know that it's a big topic in the media right now in terms of an indirect complication of lockdown. So the question arises, why has our mental health been so dramatically affected during this period? Surely COVID is a respiratory infection. It's an infection that affects other organs. It's very serious. It's very contagious. But why is there a dramatic increase and decline in our mental health as a society? And I would like to start my presentation by drawing attention to some of the triggers for this deterioration that we are experiencing. So firstly, individuals who already suffer from mental health issues, and admittedly, many of us are vulnerable to this. This in itself is an added trigger or an added risk factor for further decline when we're challenged or feel a sense of vulnerability with our changing situation. Secondly, the fear itself around COVID is a significant trigger for poor mental health. Unlike the measles or chickenpox, other illnesses which have been with us for decades, this is something which has been part of our language, part of our society for at only about 12 months' time, and a lot of it is unknown. So in itself, it creates a lot of fear. We have to wear masks, we have to gown and glove, we have to pay specific attention to hygiene, and this is all very different to our norms. There's this concept of social isolation which has occurred as secondary to the lockdown situation. So many of us are socially isolated. The only reasons we can leave our home are for medical supplies, are for exercise, and also for groceries. And this again puts a lot of strain and pressure in the way that we interact with society and the world at large. There's financial stress that's occurred during COVID. There's been significant job losses during this period and significant personal financial struggles, albeit assisted by the government where possible. But again, financial stress is a significant trigger for poorer mental health outcomes. For many people, there's also the loss of identity, the loss of going into work, the loss of potential work. This may be a valuable source of self-esteem, and the loss of this is another trigger for our mental health decline. Social distancing or physical distancing itself can be anxiety-provoking. Knowing what exactly is 1.5 meters, what is safe. The footpaths that we walk on aren't made for social distancing. The supermarket aisles with large trolleys are difficult to maneuver around. And this in itself can cause stress and anxiety upon us, trying to do the right thing all the time. Many of us are also experiencing the added burden of carer stress and trying to maintain our working life, if that's still a viable option, but also take on the duties of schooling kids who are remote learning from home, and also the stress of not being able to visit elderly relatives who may be in social isolation situations. So one of the key protective factors and our usual protective factors is our sense of community. And we see this in the concepts of church, of men's sheds, of sports clubs, of hydrotherapy classes. And at this point in time, that physical engagement, that human interaction, and that normal connection that we would reach to, we can't necessarily access. Yes, we do have the resources to do so online, but for decades and decades, as humans, we've joined together as groups, engaged with one another, and the energy in the room is so important to many people. With all of this, there's been a loss of our usual structures and our usual routines as we've had to change to the various stages of lockdown. And every 24, 48 hours or week by week, this routine and this structure changes again. So there's a lot of adaptation that we've been required to do during this period. And it's no wonder that all of this has led to significant stress. And so how do we cope with this stress? That's a really important question, because it's really part of the topic that we're looking at in our mental health and how we can emerge healthier in this lockdown situation. So I'd like to start with looking at unhelpful coping mechanisms. And one of the key unhelpful coping mechanisms which has been highlighted during this lockdown is an increase in alcohol and harmful alcohol use. And studies by the Australian National University have found that women in particular, who already enjoy some drinking, have actually escalated their alcohol consumption. And there's actually correlations with the responsibility of caring and caring for kids. So kids remote learning from home, kids at home. And this has led to an increase in alcohol use. With regards to men, increase in alcohol use has been associated with being at home and starting drinking earlier. Also, loss of job, and alcohol has been used as a tool to cope. Why has it been such a available and utilized tool? Well, it does have significant psychological effects, which are often short-term, but there can be significant adverse long-term effects as well. And in terms of the use of alcohol, why is it a go-to for us? Well, firstly, it increases the effect of an inhibitory neurotransmitter called GABA in the brain. So it can actually initially feel like it's stress relieving for us. It can also increase the reward pathways of dopamine in the brain and also increase our endogenous opioids. However, long-term sustained use of alcohol can lead to dependence, which is unhelpful. And there are significant medical long-term effects of this as listed in this slide. So how do we measure our alcohol intake? And secondly, what are the other key health issues that are arising during this lockdown time? Because being aware is part of being empowered. So weight management can be an issue as our structure and routine has changed. We may be doing more eating at home. We may be more sedentary at home. We may have loss of incidental activity and movement. We may be home baking. There's also an association with domestic violence and an increase in domestic violence. And often this can be due to periods of isolation. And we can also see the risk of cyberbullying and harassment during this period of lockdown, especially in young people who are doing a lot of online classes and are using screens as an important tool for their education, but it can have a dark side. So I want to also talk about helpful coping mechanisms, because that's what we're all really here about. It's about how can we be healthier during this very, very difficult time? What can be done to empower, engage, enable us, and move us forward? So I'd like to draw attention to this diagram, looking at the different zones, the fear zone, the learning zone, and the growth zone. But I would also like to discuss with you some recent studies looking at mental health during COVID. The first study was one which was done in Zurich, in Switzerland, and they had a period of lockdown for 6 weeks. And the findings from this study with regards to mental health were that those that stayed physically active, those that had structure and routine in their day, and those that were able to positively reframe or reappraise how things were going, coped much better. And they were able to do this in Switzerland because they had a group of people that they followed from 8 to 20 and reviewed their mental health outcomes. So when COVID hit, they were able to draw on this same group and extract the data and compare the resilience factors. Another really important study that was done in the area of mental health with regards to COVID was from China. And from the Chinese experience, what they published was that those that were high risk for mental health issues already had significant concerns about their health. So do my anxieties have anxieties? Have I got anxiety or stress over my physical health? Secondly, the protective factors for people suffering from mental health issues or not suffering from mental health issues from China were being well informed. So really understanding the health literature out there and having reputable sources of information and being able to digest it, comprehend it, and process it. The second key part of being mentally resilient for the Chinese population was understanding the hygiene measures that could protect them or prevent them from contracting COVID. So things like social distancing and hand hygiene was key to this. So looking at this diagram, if we think about the fear zone, and certainly we've all experienced this at the start of the lockdown, where we saw the supermarket shelves barren and bare. And that was a outcome of this zone where people were grabbing food, toilet paper, medications. There was a sense of fear. There was also a great sense of anger in the community where we saw disputes happening, which would normally not occur in public. People were forwarding messages received and grumpy. As we got acclimatized to this, we can move ourselves from the fear zone to the learning zone. And the sooner we do this as individuals, the happier and the healthier we will be. And that's to identify our emotions, recognize that we're all doing our best in this difficult situation. And lastly, the most important zone is the growth zone. And that is very much depicted in the studies described from China and from Switzerland. And we can take this on board to be present in the moment, to enjoy our relationships that we have, to make use of the talents that we have, and to try and share what we can with people in a positive way and see, if possible, where we can help others. So briefly, having touched on this, I'd like to conclude my formal presentation and switch back to you, Chris and Sally.
Well, thank you for that, Tamara. There will be an opportunity a little later on for questions, which you can submit through the Q&A function. But before that, Chris, would you like to go ahead?
Yeah, thanks. Thanks everyone for coming and for watching us. I'm going to build on what Tamara's been saying. There's an awful lot of overlap. If I can just get to share my my screen. Hang on. Not quite sure how to get there. So I might have to do it like this if that's all right. Not sure how to make it a full screen one. No. Hang on. Yeah. Okay, there we are. Yeah, so I'll just build on what Tamara's been saying and run through these slides. You can get a copy of them at the end in PDF format if you need it. Tamara's mentioned the risks of increased violence when we're all stuck together at home, particularly as a result of excessive alcohol consumption. If you're a woman, especially if you're looking after young children, or if you know a woman who's a mother of young kids or who is experiencing some violence or abuse, mental or physical, then there is a Domestic Violence Resource Centre of Victoria. So you can tell them about that, check on that internet link or give them a call. These are experts who know about the law in this area and who can support you in making a safe space for yourself and your kids. So they are there. You don't have to, suffer with this. And if you're a guy who is perhaps tending to lash out a bit too much and is hurting the people close to you, your woman and your kids, then that's hurting you as well. So also go to the Domestic Violence Resource Centre of Victoria, and the Men's Referral Service is operating No to Violence, and that's a really excellent outfit which will support you in coming back to more resourceful ways of being with yourself and with those who matter to you. As Tamara has been saying, community is immunity, really. That's the thing we have to bear in mind when we're being cut off from our communities or pushed together. But community really starts with the significant others, your wives, your husbands, your kids. And so the work to do, I would have thought, is on relating better. it's an opportunity if we're stuck with our family and all our old patterns are emerging, and the old behaviors, the old ways of responding that are unresourceful. This is now an opportunity to have a look at that and start to work on that. And I'll provide a few links and references for that. In terms of the China study, which is very interesting, Tamara, I didn't know about that, but one of the protective factors being to be well informed. It can be useful to get a broader perspective on what's going on here, a health and medical perspective, it being about the balance between disease and death caused by all the restrictions, the lockdowns and its sequelae, versus disease and death caused by the virus. It's a balance. We haven't heard much about disease and death caused by all the restrictions. There are several very well-conducted trials and research studies going on at the moment in different countries to have a look at actually what are the numbers in terms of how the restrictions and the shutdowns are impacting people's health and death rates. There's an established link between social isolation and the negative emotions that go along with that, loneliness, and poor health. There's a growing body of evidence that isolation and loneliness are linked in with incidents of different diseases and premature mortality. There are myriad connections to poor physical health, obesity, cardiovascular problems. And those effects on the human brain are documented, as we've just heard. Social isolation, if we allow ourselves to be increasingly social isolated, I'm afraid that's associated with an increased risk of cognitive decline and dementia and depression and anxiety. So it really is worth considering how we can use these changed circumstances, these restrictions, to learn new ways of connecting more effectively and forming our community, because that is protective. Another thing that's been debated is the death rate from the virus. You might check out Professor John Lee. He's a professor of pathology and a consultant pathologist in London. He's had a look at this, and he's recommending tightening the criteria for recording death only due to the virus. It's very difficult at the moment to separate people who are dying with the virus as opposed to people who are dying from the virus. And as John Lee points out, the moral debate is not lives versus the economy or lives versus money. It's lives versus lives. The restrictions are damaging kids' education. There's excessive suicides, increase in mental health problems, as Tamara's very elegantly outlined what underlies that. It's taking away resources from other health problems that we were dealing with effectively. Those who need medical help now, we've been hearing, won't seek it or might not be offered it. There are also effects on global food production. Everybody knows this. And how does that impact death rates and disease? Global commerce has been impacted. And really the disease and mortality effects of all that are unquantifiable, but the research is undergoing now to try and quantify it. John Ioannidis, a Stanford University professor of medicine, epidemiology, and population health, has tried to work out the death rates from the virus. He estimates that for people younger than 45, the infection fatality rate is almost zero. For people aged 45 to 70, it's between 0.05 and 0.3% of those infected we can expect to die, which is in the ballpark of seasonal flu. For people above 70, the risks of death escalate substantially to 1% or higher for folks over 85. And obviously for frail, debilitated elderly people with multiple health problems who are infected in nursing homes, it can go up very significantly. As I've said, the death rates, this is from the Center for Disease Control in the USA, from seasonal flu is about 0.1%. In terms of the risk to residents of aged care facilities who are being cut off from visits and from their community, the care given by family members is essential to their mental and physical health. And so some way needs to be found, really, to reconnect residents in aged care with their family members. And some facilities, I know in some areas, are allowing, if the family are also carers, allowing them in, obviously with restrictions. The current limits on visitors have had damaging consequences. Dementia UK and the Alzheimer's Society are calling on the government to urgently address the hidden catastrophe happening in care homes as a result of the restrictions and the shutdown. Now, this is from the Office for National Statistics in the UK. The analysis of death registrations not involving coronavirus in England and Wales. In other words, how many people are dying as a result of the restrictions in aged care? During the pandemic, there have been 5,000 excess deaths, an increase of 52% compared with the 5-year average of people with dementia and Alzheimer's disease in England and Wales. So a 52% increase in deaths, not from coronavirus, but since the shutdowns, as a result of those shutdowns. Death registrations not involving coronavirus, there's been an apparent increase in deaths due to the previous, compared to the previous 5-year average for deaths in the same weeks. And some of the reasons for that have been touched on by Tamara. Okay, so what can we do given that we don't have much choice but to follow the law and the rules? A self-study course in who you are. I like that model of moving from the fear to the learning zone and then to the growth zone. So it would be great if you can hold that in mind. Starting the learning into the learning zone is becoming aware of your feelings as they come up. This is a critical first step in so many energy psychology models and psychotherapy models. We've been very afraid of our own core feelings, our anger, our fear, our grief. This is an opportunity to get to know them, get to be familiar with them, recognize their signatures when they come up, and let them be there. So pay attention and become a witness of your feelings, feel them. Notice your thought, witness them. And then you can ask yourself, now, who is the one noticing? Here is a list of emotions. Some people don't know what emotions are, can't put words on their emotions. But it's good to just at least have the lexicon so that when you check in, you have an idea of, you can communicate perhaps with others what you're feeling. Being aware of emotions doesn't mean labeling them with one of these labels. It just means feeling it and recognizing it, the energy moving, the form of the energy. So you don't have to name it, just recognize its signature, let it be there as long as it wants, and let it leave in its own time. If you want an alternative to that, if the feeling is distressing and sharp, and if you're interested in energy psychology, you can feel it, rate it, and tap on it. This is EFT, Emotional Freedom Techniques. Professor Peter Stapleton at Bond University in Queensland is the authority on that. You can check her out. There's her, there are her links. A very useful stress management tool. In fact, it's a great deal more than a stress management tool. It can permanently resolve chronic trauma systems. But Professor Stapleton's very careful not to say that. It's been accepted in New South Wales as a stress management tool. They don't want to make great claims for it, but if you have a look at her research and her website, there's a lot of free stuff on there. You may be moved to try and use it. Another person who can be incredibly helpful if you want to use this time to move into the learning zone and the growth zone is Sri Kumar Rao. There's the Rao Institute, there's his website, and there are plenty of free YouTube videos. And he explains it so simply and so elegantly, how to manage stressful situations, confronting feelings and thoughts and habitual responses, how to manage those in a meta way, metaphysical way. So first you have to accept and allow yourself to feel your feelings, be there first, let them be okay. And then you're in a higher energy space and you can take right action. Okay, relating from presence is another absolutely key thing while we're in this lockdown. For me, you can reframe marriage. You can reframe it. And my wife is sitting here behind me, so I hope she won't mind me saying this, but you can see marriage as a very expensive opportunity to learn to grow and heal your own life, old wounds, because they're going to come up in your primary relationship very sharply and sometimes painfully. So that allows you to wake up to what's going on. Your partner is a mirror, and it's a fabulous opportunity to grow and heal. Not always easy, but you might be curious to see if you can relate in a much more resourceful, peaceful way, which is more enjoyable to everyone and very healing. Know the ground rules, love the difference between you and your wife or you and your husband, and try out a few new ways of responding, just a little bit here and there. Now, there's some brilliant stuff written by John Gray. This is so simple, what he's talking about. I've got some audios of his, which I may be able to give you a link to, but I strongly recommend that book, Men Are From Mars, Women Are From Venus, especially for men, especially if we have trouble in habitually relating to our wives. Oops, there goes that. Sorry. No, don't worry. So I recommend John Gray. Also recommend the work of Byron Katie, and for women, Christiane Northrup. If you haven't heard of her, she's an obstetrician gynecologist and just a genius in women's mental health and development. So find new ways of looking after yourself, waking up, being present in the here and now, being in your senses in the moment, in the body, feeling it, not letting the mind pull you into future or past. That's what the mind will do. It'll sweep you along and you'll feed it with energy, and you know, an hour's gone and you've been just dwelling on stuff. So wake up and you'll find yourself waking up and come back to the present. So doing these things for yourself is not the best way to support and nourish your loved ones. It's the only way, in my view. Okay, physical fitness, as Tamara has been telling us, absolutely critical. Find something you enjoy, ideally. If you can do it in a group, for example, on even if that's online. Good sleep. If your mind's racing when you go to bed, fall asleep listening to something like Louise Hay's morning and evening meditations or holosync. My mind always tended to do that. So something like that as you're falling asleep, going in both ears in stereo, forces the mind into a more peaceful state as you're going down into stage 1, and you're bypassing the frontal lobe, which is shutting down, you're bypassing the resistance, and those messages are going in. So it's a great time to reprogram a little bit as you're going into sleep. Get into nature if you can, keep an animal, a dog or two, minimize your exposure to pollution. These are all things that all of us should have been doing anyway. But now we have a greater incentive, perhaps, and opportunity to really spend time and energy following this healing path. Just in terms of the cravings for alcohol and drugs at a time like this, there's a guy I followed, Joel Wallach in the States. He was a veterinarian, but he thought that a lot of craving of drugs and alcohol was actually driven by mineral and vitamin and essential fatty acid deficiency states. The body knows it's missing something and has to have something. Also, it's maybe driven by dehydration. So if you tend to drink too much, first hydrate with water, filtered water or San Pellegrino, a tiny pinch, the tiniest pinch of Himalayan rock salt, not if you've got kidney disease or hypertension, and a squeeze of lemon. Drink as much of that as you want, hydrate, and you will not need as much alcohol, and also get your nutrition optimized. And that may involve supplements. A whole food plant-based diet, everyone knows all this. The right kinds of fat are critical for the brain to form properly and do its job and regulate your emotions. Ghee is brilliant to cook with. Prebiotic and probiotic foods. The serotonin, the feel-good hormone serotonin, and the noradrenaline, the reward hormone, are made in the gut by the bacteria in the gut. There's this massive communication going on between the microbiome and the brain, not just by the nervous system. And so if your poor gut bacteria have been hammered by courses of antibiotics, you might want to just restore them and repair them with prebiotic and probiotic foods. And if you don't know what they are, you can drop us a line. It's very simple, very cheap, and you will feel better. So look after your gut flora. I recommend a high quality multivitamin with minerals and a high quality omega-3. There's good research that omega-3 on its own reduces anxiety. Very good research on that. And other naturopathics as directed by your integrative doctor. So here are just a few references, people who I love because they're simple. I don't have the patience to listen to difficult authors or speakers. I can't be bothered. And so these are all very simple, very direct. And the interesting thing is they don't know each other, but they're all saying the same truth. They're telling us the same truth, so they can be very helpful. Eckhart, Sailor Bob Adamson, an Australian genius. In terms of hydration, that book, Quench, is very good. And I always recommend Kelly Brogan. Community is immunity. I got that from her. And if you want to know more about nutrition, please come back to our website, the NIIM website, or the Australasian Institute for Medical Nutrition, or ACNIM. You'll find fabulous resources there. So the resources are there, available. You can access them and they're there for you. So, if you do choose to take this opportunity to heal and repair your life, it's all there for you. I think that's pretty much all I have to say.
Well, thank you, Chris. Thank you, Tamara. There are many questions tonight, so some of which were submitted by our listeners. So to begin with that, I'd actually like to ask you, Tamara, many are consuming much more alcohol than usual during these times, and they're not even noticing it. How do you know when you're drinking too much? And what are some of the strategies you'd recommend to minimize consumption?
Okay, so firstly, in terms of increased alcohol consumption, so when do you know that how much you're consuming may be harmful? There's a great tool called an Audit-C tool, and that's what we use in general practice. So firstly, during a year's period, how frequently are you having a drink? So is it weekly? Is it monthly? Is it daily? And depending on that amount, you would be scored. Secondly, during each time you're having a drink, how much are you drinking? Again, is it 1 or 2 standard drinks, or is it 3 or 4? And is there any particular point when you're having more than 6? So these are the 3 key questions which would indicate, if you are scoring 3 or more, that there could be harmful alcohol use. Henceforth, the risk of dependence or a use disorder. And I would really recommend hooking into your primary health carer to have this discussion and to have a proper assessment. In terms of methods to cut down, I think the first key method is to be aware and to be thinking about it. So being in that contemplation phase is the beginning of the journey. And Chris described a number of great measures, practical steps that you can also take.
Thanks for that. Many online tonight are parents with young kids at home. It's certainly been an interesting time for children and their parents, homeschooling, the huge amounts of screen time they're getting, and consistent news coverage that can be a little bit daunting from time to time. This is causing great anxiety for children and their families. So I guess, if Tamara and Chris, if you want to add to it, how could COVID-19, the lockdowns associated with the coronavirus impact the long-term mental health of children?
Chris, are you happy for me to start?
Please, yeah.
Yeah, so I think it's a great question again. There are significant potential impacts on kids. And as we see with any disaster, the Great Depression, the bushfires, and here we are with COVID-19, a pandemic in a period of lockdown. And if you think of things from a kid's perspective, all of a sudden the norms in their life change. All of a sudden they're no longer connecting with their friends at school. All of a sudden they're restricted in terms of their normal activities, their sports. All of a sudden the adults around them are behaving differently. And for example, wearing masks, for example, not walking near to another adult. And so the whole environment for a child has changed. Secondly, if their parents, if their carers are also stressed, this would impact on a child's mental health. So children going through this experience are certainly at increased risk of anxiety, depression, post-traumatic stress. So as the adults, as the caregivers in their lives, it is our duty as best we can to manage our own mental health. Because if we manage our own mental health and provide a good example for our kids, that will have a knock-on effect for them and mitigate their risk of having issues with anxiety, depression, post-traumatic stress later on. As a medical practitioner, it's really a challenge as well, because seeing kids in the room, it has changed dramatically. When wearing masks, it can be scary. So this is a space that we are navigating through, and I think it is a challenge.
I would just add that if anyone listening to this can support the parents of young children, please do so, just by being kind to them and helping them be kind to each other. So I think that's how we help the kids more than anything, by supporting the parents or the caregivers of young children.
I think staying on the theme of family mental health, Chris, over the last 4 months, many families have spent more time than they probably ever have before in a very long time together in the same place. In my home, for example, we've invariably been working, studying, sleeping, socializing, doing all sorts of things within the same space. And whilst it's been somewhat enjoyable, I mean, we see it as a bit of a holiday. At the same time, I wonder how we're able to give ourselves space when it's hard to have a space of our own. How do we address those issues?
That's a very, very good example, explanation of what's been happening. Quite a few of the patients I've been seeing have had that sense that it's quite enjoyable, actually, this change. And people are relaxed and enjoying spending more time, actually, with their kids and with their spouses, funnily enough. But that's not the case for everyone. And for some folks, it has brought out these stressors, which I've mentioned, that naturally occur when people are living in close proximity. We all have to deal with that. Anyone who's human and living with another human is going to bring up old pains, old griefs, and open old wounds. So the current situation is just highlighting that, and there's an opportunity for folks to deal with it themselves. Not to try and change the other person or get them to be different, but to learn to love more by caring less, as Martha Beck put it. Love more by caring less. In other words, you work on yourself. That's how you improve relationships within the entire family. And we've given some pointers as to how to do that.
Sure. Tamara, did you want to add on to that answer, particularly about how we achieve good mental health when we have little time to ourselves? Or?
I think that's a really good point in terms of the loss of me time for a lot of people, especially in a closed environment. So a key factor to continuing with good mental health is creating a safe space for yourself. So carving that out in the home environment, be it a physical space or a conceptual time of the day where you can refresh and renew yourself in a way that's going to enable you to be more constructive in your other interactions with the community that you're now in lockdown with. That's fundamental.
The community, just to change tack slightly, the community's been very inspired by the dedication of frontline healthcare workers who've been so important to the response thus far and will be for some time yet. To both of you, but perhaps Tamara first, how can doctors and healthcare workers, given there are actually quite a few joining us tonight, prevent themselves from getting colds and flus? And Chris, how does a doctor, particularly an emergency response doctor, avoid, and their colleagues avoid burnout in very unique times?
Tamara, do you want to go?
Okay, I think so. Basic principles in terms of infection control have really helped me in terms of avoiding falling sick just with routine general practice. So proper hand hygiene, distancing, proper measures, medical measures. So they're the basic rules that you learn as a new graduate medical practitioner. Second to that, the basic pillars of good health: sleep, diet, exercise, knowing your own limits. That's also very key. And you do learn that. What are your limits and what are your weaknesses, and when do you need to take a break?
And Chris?
I don't have much to add to that, except that I would make damn sure I'm taking a really high quality multivitamin reliably. The list of things that Professor Sali has shown us boost immunity, very simple things: vitamin D, vitamin C, ginger root, licorice root, a couple of things like that, which are cheap. Just do it twice a day and put it out of your mind then. And I think human beings are pretty resilient, especially if there's a community of frontline doctors and you can have time to share and connect.
There's a question from the audience about whether we can feel safe going to our doctors. I mean, the pandemic perhaps has caused a few to forget about their ongoing health needs. And I mean, if I can add on to that, most importantly, as we transition out of the COVID-19 world, how do we start to bed down some of those stubborn bad health habits, weight gain, stress, alcohol consumption, etc., formed over the last 6 months? So from the audience was whether we can feel safe going to our doctors. I'm sure we all encourage you to do so in the interest of maintaining your health needs, but also how we can actually start to make those interventions now. Chris, if you wanted to start off.
Yes, you can feel safe going to your doctors. They've all got excellent hygiene and safety measures in place. But I would again state, get online and look at some of the authorities that we're pointing to. We're giving you the resources. Investigate a more integrative way of looking after your health in terms of medicine. Investigate more integrative approaches and see if you might find an integrative medical practitioner or a naturopath or someone who's trained and does this to give you an opinion on your difficulties, on your problems, your symptoms. Just get another opinion, just open your mind and hearts. That's what I would say.
Yep, so I think the findings with regards to chronic complex illness and this period of lockdown have been that people are presenting a lot later and that their chronic illnesses are not being well managed. So this is really important for all of us because we're all patients and some of us are also health practitioners. But in terms of good self-care and good health during emerging healthier from this lockdown period, it's important to still prioritize chronic illness. And if there is any concern regarding your physical health, then present. And certainly the government has enabled this by the use of telehealth. Certainly here at NIIM, all the practitioners offer this service. So I would really recommend not prioritizing your health. And with the use of telehealth, you can feel safe to access a medical opinion, and where appropriate, your clinician will ask to see you physically.
We're sorry at the last question this evening, and there have been quite a few sent to us before this in relation to aged care and looking after elderly members of society. So to close off, unfortunately, many immunocompromised people and residents in aged care facilities have been in persistent lockdown and quarantine since, in some cases, the beginning of March. Chris, with little human interaction, weaker immunities and long-standing health concerns, how do we manage the impact of this at a community level? So on the families of those in the facilities, on the staff that support those facilities. Chris, have you got some advice on managing these individual stresses and situations?
It's very difficult, I think. I would hope that relatives of elderly folks in residential aged care can talk to the aged care management and find out whether there might be a way for them to keep in touch with their loved one in the nursing home, and find out what can be done. It may mean talking to the local authorities and seeing whether exemptions have been made, as they have in some areas, for if you're a carer, for you to go in, and how often. So push for that. Other than that, look after yourself with your own community of other family. But other than that, it is very tough, I think, on the elderly who are in care. I think they are the people who are really suffering, and their families, of course.
Well, thank you everyone for participating in tonight's webinar. Dr. Nation spoke a little bit about the hidden issues that we're not very aware of that have come up over the last little while, and some of the more appropriate, easy to implement interventions to bed down those habits. And Dr. Corcos spoke about the stresses that many of us, our families, our loved ones, our colleagues, are facing, in some cases for the first time. We hope you found it informative and illuminating, and of course we've recorded it and we'll share it with the community alongside all of the references and presentations shared earlier. NIIM, as I mentioned before, relies on the support and generosity of our community to run events like this one. And whilst we've had to suspend our public attendance events because of the coronavirus restrictions, your support will allow us to continue to build on this and other instances of public health promotion into the future. You can do so, you can support us by going onto our website or reaching out to the email, via email. The NIIM clinic and dispensary is open at this time. More so than ever, our health has never been more important. Now, doctors and clinicians are excited and so able to support your needs. You can make an appointment by calling our clinic here in Melbourne or on the Gold Coast as well. Thank you very much for your interest, your support and participation tonight. We look forward to welcoming you again, albeit virtually in the near future. And in the meantime, don't forget to wear your mask, stay safe, and we'll see you in the clinic soon. Have a good night.
See you.